Hi everybody, I am going to be taking 5 questions that I have often been asked as a clinical psychologist today. So the first question that I will be taking is, what are my views on confidentiality? Confidentiality is the most important thing when you're dealing with patients as a therapist, because if there is no confidentiality, which is a part of our ethics, right? If there's no confidentiality, then there really is nothing between the patient and the therapist. You are responsible for how your patient's health is, how your patient's well-being is, and maintaining that decorum of not letting things out of therapy is extremely important. At the same time, there are some areas where we have to breach the confidentiality. For example, when a patient is very severe or critical and they have suicidal tendencies or things like that, on those lines where there's self-harm behavior, then you have to breach confidentiality and let the family and caregiver know. But this is solely because the patient's life is at risk. But apart from this, there is 100% confidentiality. Whatever is spoken in the therapy does not go out of the therapy room, or at least that is how it's supposed to be. Multiple cases where things like this happen, that the patient's diagnosis is revealed or things about the patient is revealed. For example, when we had the Sushant Singh Rajput case, whatever was done by the mental health professionals was unethical. So confidentiality is very, very strict in our profession. And until and unless you are a minor, or until and unless your life is really at risk, it is rarely breached. Even when you're a minor, there are very few instances where we have to breach confidentiality because you're not capable of taking decisions on your own. But it's very rare that that happens in the profession, and yes, it's extremely important. Okay, next up is, how do I deal with stress? So I've got this before as well. Burnout is extremely common in our field, and it's something that we experience on a very regular basis. So I definitely practice mindfulness on a daily basis, and I follow the 5-step technique. That's something I've spoken about multiple times. That is the 5-4-3-2-1 method. As soon as I feel extremely overwhelmed, or I'm in a state of panic where I'm too overwhelmed with work, I use this technique. 5 is seeing 5 things around you, 4 is smelling 4 things around you, 3 is hearing 3 things around you, 2 is touching 2 things around you, and 1 is tasting something around you, whatever you can taste in your mouth. So this is the 5-4-3-2-1 method that helps me just instantly relax when I'm in a state of panic. But when I'm generally very anxious, I do my muscle relaxation. That really helps. And I generally regularly like to follow mindfulness. That really works for me. So I do a lot of grounding techniques. I do it on a daily basis because it can be very overwhelming in this profession. So it's really something that helps me, and it has helped me in the long. Apart from this, I've always believed in taking breaks when you're feeling extremely anxious and you're overwhelmed and there's too much to do. So taking breaks and, regulating yourself, going on walks, just going outside, taking a day off, all of these things are very normal. I know that healthcare professionals say it's very hard to do it, but you have to do it for yourself. Another thing is, I never compromise my sleep for anything or for anybody, and that's something you should also believe in. I sleep very early, I wake up very early, and I like it that way. It helps my cycle function better. So I do not compromise on my sleep. Even if there is an exam the next day, if there are reports to be given, if there is anything to be done, I will do it by like 10:30, 11. But after that, I am flat out. I do not stay past that. That is not just something that works for me. What is my advice to future clinical psychologists? I think my advice to future clinical psychologists would be that take the path as it comes. Don't force yourself when you're doing your bachelor's that you want to do 8 years of education and become a clinical psychologist. Don't do that, because that might not always be the path for you. So take it as it comes. Look at your area of interest. See if you're comfortable seeing these type of patients. If you're comfortable in a medical setup, if you're comfortable in a hospital setup, if you're comfortable studying this long, don't just do it for the name and the heck of it. Do it if you're really interested in it. Once you're in this field, practice a lot of things. Be ethical, not only with your patients, but also set boundaries for yourself. It's extremely important. You can't just be available for everybody at every time. You need to set your boundaries straight. Don't get too attached to your patients. Your patients doing very well is not your responsibility. Your patients doing very badly is not your responsibility. Transference is something that's very common in our field. So try very hard to avoid that. we don't want to see that in the long run, right? So it's something we do face, but we are going to try to limit that. And how do we do that? We do that with supervision. We do that by constantly understanding the case better and not attaching the outcome of the patient's outcome to yourself. Whatever has to happen will happen. You will do your best. You will do your play your part, but their recovery or their deterioration is not in your hands. So try to do that, and constantly take breaks is something I always tell my patients. Also, I say this to upcoming doctors as well in the field. Take breaks. It's not rocket science. We can all do it. We should do it. And when your body gives you a signal to stop, know where to stop. That's very important. And you are going to face a lot of setback because it's an allied health science field. You can feel that people may not respect you as much. I mean, in the field of psychology, you'll get a lot of respect, but when you're in the medical hospital, they'll just be like, oh, it's just clinical psychology. Never ever let that break you, because you know how hard you work to reach there. Even if you're not doing clinical and you're doing your master's and becoming a counselor, it is a big deal. Studies are studies, how much ever you do, and we know how tough the course is. So keep at it and don't feel upset about what anybody has to say, because nothing really matters, because you know what you're doing and where you're going. Okay, next question is, how are mental health disorders caused? So there are multiple risk factors for mental health disorders per se, but the mental health in general, which is not taken care of for a long period of time, can lead to severe mental health conditions. And mental health disorders can be caused because of multiple factors. Genetics can be one of them. Environmental factors can be one of them. अगर आपके environment में there is been a very uncongenial environment that you're raised in, if there's trauma, if there's abuse, and if there's parental pathology, all of that can come as environmental factors. If you have had poor parenting strategies, poor parenting styles exhibited by parents, all of that makes a difference. Other risk factors are your physical fitness as well. Even physical symptoms can play a role. What you eat, your sleep, your general schedule, all of that, your physiological self is also very, very crucial in determining your mental illness, your mental health condition. So that, then genetics, yes, a lot of conditions like schizophrenia, bipolar, and some personality disorders as well are passed down by genes. So genetics can play a role. Even neurodivergent conditions like ADHD and autism can be passed down to your offspring. So yes, these conditions can be caused by genetics, and genetic factors along with environmental factors and other physiological symptoms can increase the risk of mental illness and mental health disorders. And you can prevent that by having a better lifestyle, by physiologically functioning better, by biologically functioning better, and by catering to your overall health and well-being, by basically having a routine set for yourself, taking care of your diet, your exercise, and reducing your stress level, because that increases cortisol levels. When they increase, your stress hormone is activated, and that leads to anxiety. If it's for a long period of time prolonged, can lead to depression. That can become a condition. So this is how it works. I'm not saying all conditions are caused like this, but your environmental factors along with your biological factors play a crucial role. So it's always a biopsychosocial model of mental illness, and you should understand the signs that your body gives you and try to work around it. What made me choose psychology as a career? So I think if you ask this to a psychologist, most of them are going to say very similar lines, that they probably had their own traumas that they were addressing while they were interested in the field. And I, like a lot of the other psychologists, felt that there were multiple things that I did not address as a child, and I started understanding the subject more to understand myself better. And in the process, I felt that I generally was always good with people and I could understand people very well. Like, I just felt that if I'm around you, like, I can understand what you're feeling. Like, it's just a very innate gift that I think a lot of people don't have. So I think that's something I did feel that I have in me, that I don't know, I've never been wrong about people. It's not that I'm reading your mind, but I understand the nerve of a person. Like, I understand what your intention is. And with that, it's very easy to understand what you feel, how you emote. And that also comes from a place that I felt that for the longest time I had to understand my own emotions for a very long period of time. So that really helped me analyze and understand other people's emotions as well. And generally, I think it's just a people. They say, it's like you're able to have like a people connection. You're able to connect with people. I think that's something I do connect with. I don't make superficial relationships. I cannot do it. I'm very, very. I can't be fake. I just can't do it. Even if I try, even if somebody tells me superficially do something, I'll just like look awkwardly, and I'm like, I can't. Either I'm all in or I'm all out. So I think I always knew that about me, that I was a people person, and my relationship with people will be either 100% or zero. So since I understand people to that level, like that's a level I go to if I know you. So I felt that that's an area that definitely is something I can look into. And I had a lot of things I wanted to address myself in my own life, my own past. And I think that psychology gave me a very, very good gateway to do that. So I just felt that it's the right field for me. And as and when I kept progressing in it, clinical became my area of interest because I wanted to work with patients and I was interested in psychopathology, and that's just what led me to becoming a clinical psychologist. My favorite psychologist. Okay, this is a question I really wanted to answer. So I know a lot of people say Sigmund Freud because they probably know only Sigmund Freud. But for me, truly, I think it was Mary Ainsworth because I'm somebody who's very, very, I've studied the attachment styles very, very deeply, and I felt that Bowlby's attachment styles and the way Mary Ainsworth described it more in detail, I think that's something that stood out for me a lot, because when I look at it from the lens of even couple therapy, it's something I enjoy doing a lot. I think the attachment styles play a crucial role in a child or an individual's entire life, whether it's in their romantic relationships or it's in their friendships or it's in their general functioning. I think how they have been attached to their caregiver at a young age really impacts their overall, their life in the future. So I think that's something that I really, really enjoy working on. And it's something that I've tried to understand more and more, when I'm dealing with patients as well, because how you are attached to your caregiver at a young age truly, truly defines how you are going to be with your partner in the future, or how you make relationships, or how you work in different areas of your life, how you look at yourself. So I think Bowlby's attachment styles are something that stood out for me, and Mary Ainsworth's good enough mother's concept was something that really stood out for me. Okay, how do I describe myself as a mental health professional? I'm an extremely I am a workaholic to a great extent, but I also like to have fun. So there's like there are two different sides to me. I can't work all the time. I can't chill all the time. I need to have a very perfect balance between the two. But yes, it's always 70-30 for me. I think work takes up a lot of my time. But apart from that, I'm a very jovial person. I like to have my fun. I like to hang out with my friends. I like to go out. I look at life from a very realistic perspective, and I don't fantasize anything. I don't think I live in a delusional reality. I'm very practical about things. That's just the kind of person I've always been. I have a very disciplined lifestyle, at least in terms of my work. In terms of my physiological functioning, I'm working on it. But I'm, apart from that, disciplined in terms of my work. And I make a lot of friends. I am social, but I don't socialize as much. I am social. I'm a social introvert, I would say. I talk when I'm comfortable, and when I'm not, I don't. So it's very, very selective for me that way. But once I get comfortable, I'm quite open. And I love psychology. I think it's something that I'm extremely passionate about. It's something I truly, truly love. And I genuinely enjoy being in this field. I enjoy growing in this field. I think there's so much scope in this field, and I am excited to grow more from here and only go up and above in terms of knowledge and in terms of helping my patients to get the best treatment that they rightly deserve. My approaches in therapy. So when you ask this to a clinical psychologist, since we have multiple approaches that we use, it's very, very patient centric, right? So if I have a patient who's undergoing, say, anxiety and there's a functioning problem, I will go for CBT. If there is an acceptance issue and the thoughts are like very obviously stated, then I would go for ACT, that is acceptance commitment. If there's a problem with like a condition like say OCD, and there are multiple the patient is having multiple intrusive thoughts and obsessions and compulsions, I'll go for ERP. And if there is a personality disorder, say if it's borderline, in most cases we go for DBT, which is dialectical behavior therapy. For conditions like substance abuse, we go for MET, which is motivational interviewing. So I think with every specific psychiatric condition, the therapy differs. But yes, in a lot of cases, we use eclectic approaches, right? So that is eclectic approach. There's just the type of therapy, but the approach it's really I really enjoy the psychodynamic approach to therapy, which talks about the past life and the childhood and traumas and how things stem from your childhood. But realistically, it doesn't work, because when you're dealing with patients who have certain specific symptoms, you have to cater to their symptoms according to what comes with. And I always believe in starting from the general symptoms that an individual is presenting currently. So I start with that and I focus on the functioning, which can only happen with medication and therapy. And once the functioning improves, then we move on to step 2, that is looking at the deeper, darker parts or aspects, focusing on the emotions and the thought patterns and everything. But initially, you need to focus on the functioning. So that's how I work in therapy. And obviously, it's very tailor-made. It's very specific to every patient. And I like to work around it like that as well.